I just wanted to start by emphasizing how much teachers value in-person learning and how dedicated teachers are to having schools remain open and students in attendance. Of course, we have great online programs and online education as well, but I'm speaking of, the vast majority of students that attend schools in person. And we feel as teachers in BC, it's critically important that schools remain open and safe. And this is why we're frustrated that we're both planning for functional closures right now in this week that we have had, and yet there are additional health and safety measures that we think should be put in place that there's a reluctance on behalf of government and the provincial health office to put in place. So I'm specifically talking about mask quality here. That has been a topic of conversation both nationally and internationally. We do think that N95 should be available to both students and teachers upon request. We are gratified to hear that masks will be readily available and that their importance will be underlined, because one of the issues that we've been dealing with in schools is a lack of support for teachers around making sure that the provincial health order is in fact enforced. And so we have medically vulnerable teachers and medically vulnerable students. And we also want them to be able to fully access both work and school. And so we think N95s are a small step that could add to the layers of protection that Dr. Henry has referred to. We also think that teachers should be prioritized for boosters. And while teachers were fast-tracked for the original COVID vaccinations. Surrey teachers were the ones that actually got the immunizations right away. And then folks might recall that there was a lack of supply of vaccines. And so most teachers got their vaccinations at the same time as their age-based cohorts and aren't coming up any earlier. And so, we've also heard from many teachers that are having a hard time booking immunizations early in January. They're going to be later in January for their booster shots. And, we're concerned about January. We also know about half of the districts in the province don't have MERV 13 filters in their ventilation systems. We've been working with the province around ventilation systems, and we would like to see what the plan is around mitigating the mitigation strategies in those schools that don't have MERV 13 filters. This is not something that we have heard. We know how Omicron is spread. We know that it's an aerosol transmission, and we know the importance of masks and ventilation systems in this context. We also are concerned with vaccination rates of school-aged children. And for the 5 to 11-year-old students in elementary schools, we are quite concerned that those first doses are quite low right now. We realize that we're early on in the immunization program for 5 to 11-year-olds, but we would really like to see much more emphasis and placed on the immunization of 5 to 11-year-olds and access, because we are hearing, issues, especially in northern BC, around easy access to immunizations. And so, in terms of the 5 to 11-year-olds, Vancouver Coastal has the highest immunization rate for those first doses, and that's 52%. And Northern Health has the lowest at 23%. We're also concerned specifically in Interior and Northern Health around the vaccination rates for the 12 to 17-year-olds. So in Northern Health is at 63%, so that's behind the adult population. In Interior Health it's 73%. So we would like to see much more of an emphasis placed on access to those vaccinations for school-aged children. And so I think, what we're trying to prevent are the functional closures. With this week, which was an important planning week, families had some notice and they could make some plans. But our concern is that when it comes to functional closures, there'll be very little notice, and that could be very disruptive in the system. So we think by ensuring there's enhanced masking available, boosters for the adults, a real emphasis on vaccinating school-aged children, and putting in HEPA filters and other mitigation strategies in the schools that don't have MER 13 filters, we think that this could support schools to stay open. And this is exactly what we're trying to prevent, are these functional closures. So I think I'll just leave it at that, and I'm happy to take questions.
Thanks, Terry. First question, Zhao from Globe and Mail.
Oh, hi, Ms. Maureen. So you addressed the importance of N95 masks just now, but Minister Whiteside just said at the briefing that she would follow Dr. Henry's advice and only offer 3-layer masks to staff and students, noting other layers of protection like self-checks each morning mean respirators aren't needed in schools. So what do you make of this calculus, especially after experts say anyone in indoor public spaces needs an N95 to best protect themselves against the spread of Omicron?
There's a lot of information circulating about N95s and the length of time that they protect the folks that are wearing N95s. And of course, you're protecting yourself and others when you're wearing an N95. And for the length of time that students and teachers are in school, we think N95s are appropriate. I would also note that while there are measures being planned this week to sort of mitigate the crowding in hallways and things, there's no changes to the number of students in classrooms. And so, the most common class size in grades 4 to 12 are 30 students per class. And as we know, we have plenty of crowded classrooms. And so we think this is a small strategy, just like we wanted to put masking in place in the first place, and we had to really advocate for masking to be put in place in the first place. We think that the N95s ought to be available, and this ought not to be something that is a barrier for anyone in terms of being able to access education. And so, we want to see all teachers being able to work, including those who are medically vulnerable. We want to see all children being able to access their education, including those who are also medically vulnerable. So we think N95s are just a prudent step that would add to the layers, and why not add to those layers? We don't see any specific barriers that have been identified by the province or the provincial health office as to why not provide N95s.
Thanks. And Zhao, do you have a follow-up?
Yes, I do. Thank you. I'm also wondering, how many teachers have had the 3rd dose so far? May I know if you have the number? And we also hear a lot of concerns from parents saying they might not send their kids back to school next Monday. If you have the preliminary number in terms of whether how many students may not show up next Monday?
Sure, thanks for the question. And we don't have numbers in terms of boosters, as I say, that's why we're advocating for teachers to be fast-tracked for boosters, because we are hearing from teachers their frustration about not being able to access the boosters. Teachers really stepped up and got vaccinated at very high rates. So 96% of our members are vaccinated. We have also worked with the Employers Association on an agreement around if districts decide to put in vaccine mandates. And so, we know that while 96% of our members are vaccinated, it doesn't mean that 96% of members in every single region of the province are vaccinated. And so we are supportive and have paved the way, as far as we're concerned, to have employers put in vaccine mandates if they wish, or if they choose to. And so, all those agreements are in place. That can certainly happen. But what teachers are now saying, even though we're vaccinated at 96% level, we're saying we also need quicker access to boosters. Again, we think this is a prudent step because it will, hopefully allow or prevent, I should say, some of the functional closures that we're really concerned will happen throughout January. And so, it seems to us that it would be just a responsible and reasonable measure to make sure that teachers have their booster shots, especially when we're looking at the added complexity of the teacher and the education assistant shortage. So we think all education workers, including support staff, should have early access to the booster shots. Again, we're hearing teachers saying that they can't book their appointments as early as they like to. And so it's, was helpful to hear that those, generally those more access to booster shots are in the works in terms of the provincial government's plans. But we, think that teachers basically can't get those booster shots soon enough. And so the issue that we're facing is that should a lot of teachers be ill, and not be able to attend work, and should education assistants be ill and not being able to attend work, we just don't have enough replacement teachers teaching on call or replacement education assistants in order to fill those gaps. And so we're concerned that the teacher shortage, the EA shortage, in addition to the lack of access to or early access to booster shots, will end up with more functional closures than need be if we were able to take these additional safety steps that we are advocating for.
Next question is from Leslie at Fairchild. Leslie, if you were there, make sure you're unmuted.
Hi. Hi, can you hear me?
Go ahead from
Hello?
Fairchild. Yep.
Yeah. So, my question is like, is there any plan for you guys to maybe to come up with a hybrid setting of in-class learning and also online learning, given there's a lot of uncertainty in future. Hello?
So the problem with hybrid learning that we've experienced thus far is that there hasn't been adequate additional staffing in order to support a hybrid model. In other words, teachers can't be expected to both teach students full-time in their classrooms and teach students remotely as well. And so in order to support a hybrid model, there would need to be additional teachers hired. And that's part of the issue that we faced before. That would mean additional, the province would have to make an additional investment in supporting a hybrid model. And teachers are dedicated to teaching students in person. And we think that in-person learning is the best. In terms of regular classrooms, again, I want to stress that we have regular online learning programs that are excellent programs, and we have excellent teachers staffing those programs. But of course, with the hybrid learning and the need to hire additional staff in order to support hybrid learning, the challenge again is the teacher shortage, which I will say the teacher shortage is not new. The teacher shortage was in place pre-pandemic. We have been raising concerns about the shortage for a very years now, and now we're at the point where in a pandemic, not enough has been done to address the teacher shortage, and now this could end up in more schools closing because there hasn't been quite frankly appropriate planning around the teacher shortage for a number of years now.
Fairchild, do you have a follow-up?
No, that's all.
Thank you. And Robin from City News 1130.
Hi there, can you hear me?
Yes.
Oh, good. Oh, thanks for taking my question, Terry. I'm wondering about these single exposure notices that we're going to be seeing in school, that we're not going to be seeing in schools anymore, and now more focusing on attendance rates. What do you think about that?
Well, we're concerned about the lack of information put to both families and teachers. And we've been concerned about the lack of information, quite frankly, all this entire school year, because there has been a reduction in communication based on exposure notifications, for the entirety of this school year. And so the problem is that when there isn't enough information, then, folks just don't have what they need to make informed decisions about their daily lives. And so we are very concerned about that. We do understand that the testing system has been overwhelmed, and that the contact tracing process has been overwhelmed. But what we've asked the province and the provincial health office to do is delegate the ability to communicate with families to schools. We know that schools can't engage in contact tracing, but often what happens in schools is that both families and families and staff do often notify schools when they do test positive for COVID-19. And so we think that schools could facilitate information sharing about COVID cases, of course, protecting privacy, which can definitely happen. But so we think the more information, the better. And so we are concerned that this is going to be based on attendance only, because what that means is that, there's going to be a situation where students get ill and staff get ill before anything is triggered. And so, rather than having kind of a more early warning around the regular notifications. And so we know it's not going to be normal, but we do think that more information could be shared from the school level in a responsible, confidential way.
Thanks, Robin. And do you have a follow-up?
I do. Thanks, Rich. More of a broad question here, Terry. We've been talking to parents all week, specifically today. A lot of anxiety among parents going into the school next week. What would you like to say to BC's parents heading into next week?
Well, thanks for the question. And there are a number of things that parents can actively do to ensure not only their children are better protected, but other people's children in their classrooms as well. So we don't know which children are medically vulnerable necessarily. Families don't necessarily know, their child's classmates who might be medically vulnerable. And we also don't always know the family members of those students who might be medically vulnerable. So two things that parents can do that we absolutely encourage them to, that is ensure that their children get vaccinated. I cited the low vaccination rates amongst the first doses for 5 to 11-year-olds. We are very concerned about that. And in particular in Northern and Interior Health, we're also concerned about the low vaccination rates amongst the 12 to 17-year-olds. So please get your child vaccinated. As we heard Dr. Henry say, even the first dose is protection for your child, and that's really vital. And the other is to ensure that your child has a properly fitted mask and that they are encouraged to wear it. Mask wearing has been an issue that has been really challenging for teachers, and we need more support around that. So we would absolutely encourage families to make sure that their child, wears their mask and understands the importance of wearing their mask as well.
Next question is Nick from Canadian Press.
Hi, thanks for taking my question. My question today is about filtration systems, specifically portable ones. I'm curious why some school districts won't allow parents to donate portable filtration systems that could be used in classrooms.
Well, thanks for the question. And we do understand that there needs to be a bit of analysis in terms of the circumstances in the classroom and the ventilation system in place in a school. And we also have heard that parents have fundraised for ventilation or for HEPA filters and haven't been able to put them in schools. And there's really been a lack of information around why that is. So what we know is that about half of the districts in the province don't have MERV 13 filters. Even some of the new builds, for example, in Prince George, there are some new schools that also don't have MERV 13 filters. MERV 13 filters are the minimum standard according to the health and safety guidelines that filter air in an appropriate way for the situation that we're in. And so we would like to see mitigation strategies. And if HEPA filters aren't appropriate in a particular space, then what is appropriate? What we do know is one of the strategies districts have used is telling teachers to open windows if a teacher happens to be in a classroom with windows that open. That is not the case everywhere, certainly. And when you're in a record cold snap, that's obviously obviously not appropriate. We also know increased airflow from the outside is the strategies that districts have used as well. But we also know from the information districts have shared with the province that many of them had to stop doing that because of the cold temperatures. And so we've been pressing the province, in those cases, what are the other strategies that are being used when MERV 13 filters aren't in place? And so there is a lot more that can be done and should be done, we know, around sharing information with families and with education workers around the status of those mitigation strategies. I will say that the province has done a good job of gathering information from districts about what the state of their ventilation systems are, and that has been a tremendous amount of work. But the next step now is, what are those mitigation strategies and what's the long-term plan? So the mitigation strategies that we're talking about, we know are stopgap measures for right now, because we know how Omicron is passed. But we also need to know, what are the long-term strategies? Like, how are our ventilation systems in our schools in BC going to come up to standard? We know that takes a significant investment, and we need to see some plans and timelines around that.
Nick, do you have a follow-up?
No, I do not.
Thanks. And Richard from Global.
Hey, thanks, Rich. Thanks, Terry. I missed the preamble, so I don't know if you got into this, but do we have any sense yet about what percentage of teachers are sick as of, today or yesterday? Has there been any reporting back from the districts, and are you worried about potential functional closures as early as next week?
So we are very concerned about functional closures. I don't have a percentage of the number of staff that are ill or are not available this week. But that was part of the purpose of this week, is for districts to do that analysis. Again, we think that by supplying N95 masks, by putting in those mitigation strategies in terms of ventilation systems where they're inadequate, and ensuring teachers have fast track for booster shots, we think that functional closures could be limited. We're still concerned that they are going to happen, and we're concerned that by using attendance as a trigger for further investigation, that means numbers of staff and students are sick already. And so we have lots of concerns about functional closures. We want schools to remain open, and we think there are a number of steps that the province could take that they're not taking to try and prevent as many functional closures as possible.
Richard, do you have a follow-up?
Dr. Henry also said, Terry, that close contacts will be allowed to go to school. That could be a teacher, that could be a staff, it could for sure be a kid. Does that make you worried that there will be close contacts to COVID cases in the classroom on Monday?
Well, it does concern us, and again, we have students in classrooms where there's been no reduction of the number of students in classrooms, and we know that we have full schools, and schools are controlled environments, but they're not contained environments. In other words, students in a classroom don't just spend time with those particular students. They have their lives outside of school, as do teachers, and so we are concerned that with the spread of Omicron, with the fact that Omicron spreads even to vaccinated people, and we're concerned about, again, elementary age students in particular, because the most cases of COVID-19 that we've seen in the system has been in elementary schools. In other words, according to the WorkSafe data, the vast majority of teachers who have gotten ill with COVID at work have been elementary school teachers. And so we are concerned about the spread of Omicron through our schools, including close contacts being able to come to work. So the health check is going to be very important. We're going to have to and that's another thing families can do, is really support that health check and not send your child to school when they're ill or have any symptoms. School staffs are going to have to do the same. Again, lots of concerns around in ensuring that schools are going to be able to remain open.
And Shrishti from the Burnaby Beacon.
Hi, Terry. Thanks for taking my question. Just as a, I guess, follow up to Richard's question there, do you want to see that recommendation changed at all? Where if a student or staff member has family who are confirmed COVID cases, should they be keeping that child home?
Well, certainly, we think that there should be monitoring for symptoms, and we do think that there should be an abundance of caution used here. And so, we think that every step that can be taken to ensure that schools can remain open should be taken. And so, that's one strategy that can be in place. So, our whole goal here, and again, close contacts, being able to come to school really does underline the importance of mask wearing and the quality of masks as well. So we want to see all the measures put in place that are feasible in order to keep schools safe. We think the measures that we're advocating for are absolutely feasible and reasonable. And so we would like to see an emphasis on those additional measures as well.
And do you have a follow-up?
Yes, please. So today, Dr. Henry said that, the risk of transmission of any sort of pathogen in classrooms is quite low with how things have been set up. But at the same time, we're hearing that businesses should be prepared for a third of their staff to be off sick at any given point. Do you think the quote unquote enhanced measures in schools are that strong that there's that big of a difference between schools and workplaces?
Well, I think part of the unknown that we're dealing with is that Omicron is so contagious, and we haven't had schools open with the Omicron variant accounting for so many cases. And so, I remember saying the exact same thing when it was the Delta variant. We just don't know. And so, schools are preparing for, a lack of staffing as well. And so, the measures that have been announced thus far are the same kinds of measures that we've already seen in schools. And we, again, don't know their efficacy in terms of Omicron, and we have some concerns about that. So we have been advocating all along for more prevention measures to be in place to keep schools open. And I would say that what we're advocating for, especially mask quality, the vaccine clinics in schools and the booster shots for teachers, these are preventative measures that we think could keep schools open. And rather than kind of waiting until folks are sick and students are sick to do that investigation, we would rather see some front end loaded additional preventative measures in place, so that there's just we have a better opportunity to prevent the spread of Omicron within schools.
Okay, now Sinjin from CTV.
Hey, Terry, you mentioned something earlier about teachers having trouble with students in masks. What did you mean by that?
So I mean that it's been quite challenging. Once there was a decision that Dr. Henry made to put a provincial health order in place, we have encountered some resistance from families, quite frankly, around their students wearing masks. And so and we know there's an exemption process, and that exemption process is important, and it's important that it be in place because not everyone can wear a mask, and we completely understand that. But in terms of the exemption process, what we would like to see is there is a pretty thorough process laid out, that when an exemption is declared by a student or a family member of a student, that other safety measures need to be put in place. What we're seeing, unfortunately, are really broad-based exemptions without further kind of conversations happening. But beyond exemptions, we're also just seeing mask refusals, especially in some parts of the province, especially in some of the northern parts of the province, the interior parts of the province. But quite frankly, it's very widespread. And so I talk to teachers, all the time in general meetings. We do a lot of remote general meetings these days. And the number one issue that is brought forward at every single meeting I go to is a mask wearing compliance. And so, I'm happy to hear Dr. Henry talked about the importance of mask wearing. Minister Whiteside talked about the importance of mask wearing. We really need district administration and as well to really emphasize the importance of wearing masks. We think that was missed when mask wearing became a provincial health order. There just wasn't enough emphasis about the fact that this is a provincial health order. It's no longer a recommendation. So, you know, we've gone from recommendation, which was very difficult. Teachers were trying to engender a sort of culture of mask wearing. Then we went to a provincial health order. And, you know, we just have seen resistance. And so teachers are working really hard to make sure students wash their hands, wear their masks, you know, stay as physically distanced as possible in a crowded classroom. But what we need is some help. And so we need the help from district administration. We also need some help from families to really talk to their students about the importance of wearing masks.
So it sounds like, I'm sorry, I'm jumping. Is that okay, Rich? I'm jumping in here. So it sounds like you're like a bit of a two question, but just clarify as well here, Terry. It sounds like maybe some parents are saying you don't have to wear a mask. And so they're saying that to teachers and the teachers have to enforce it. I think that's kind of what you're saying, Terry. And the second part is, of course, parents are gonna be wondering, okay, my kid has the sniffles and he might have a headache, but he has no fever. Do I send him to school or not? I guess, what's your protocol? What would you like to see in terms of what parents do and when they send them, when they don't send the kids to school?
Well, thanks for the question. And I think, you know, what we heard Dr. Henry say, which I really want to underline today, is that if in doubt, you know, that health check is really important. If in doubt at all, keep your child home. The rapid testing is going to be really critical. We were certainly hoping to hear a lot more details about how the rapid test will be implemented in schools. And unfortunately, that detail is not there. But, you know, the rapid testing being available for families and teachers and support staff is going to be really critical in order to do that assessment. But at this point in time, given the prevalence of Omicron in communities, and again, we heard again today that schools are reflective of the communities that they're in. And what we're seeing in many communities is very high community transmission of the virus. And so given the situation we're in, if families are at all in any doubt about, you know, their child's health status, they really should keep their child at home and monitor those symptoms. That daily health check is going to be really important and strictly adhered to in schools. And that's, you know, something that has been in place all along, but, you know, really needs to be enforced at this point. And again, schools can only remain operational if everyone is really united in terms of making sure that all those safety measures are in place.
I've got another question coming from Darren from my PG Now. Folks, if you joined in late and you'd like to ask Terry a question, just put your name and the outlet into the chat. Darren, go ahead.
Good afternoon. I'm just curious as to when it comes to functional closures, sort of at what point or threshold will you go to a functional closure? I understand it'll probably be different for most schools, but I'm just curious as to when do you go towards that functional closure?
Yeah, and that's a question that was obviously posed to the minister today, and there really, you know, wasn't a solid answer. And so, you know, where that analysis will be done on a school by school basis, we do understand. You know, there are obvious limitations because of the teacher shortage and the education assistant shortage. That, you know, depending on how many staff are ill, you know, in some situations, as you stated, it's going to be a smaller number than in others. It really depends on the size of the school, and the kind of number of classes in the school and all kinds of other factors. But, you know, we were hoping to hear a little bit more concrete information about what would signal a functional closure, and you know, that certainly wasn't information that was shared today. But, you know, functional closure means, quite frankly, there just isn't enough staff to operate the school and properly supervise students. And so again, we want to avoid that as much as we can. And, given that there is a lack of replacement staff for folks that are ill, that's why we think it's really important that the additional safety measures that we're advocating for be put in place, because we want students in school. We want to avoid functional closures. And, we're concerned that we're not going to be able to do that unless these additional safety measures are in place.
Darren, do you have another question?
No, thank you.
Okay, folks, that's it for my list, unless I've missed you. If you would like to ask a question, just pop into chat. If not, we will let folks head on their way. We will be posting this on our YouTube page as well. Oh, Parmeet, I see you just raised your hand there. Go ahead.
Hi, my question is, the schools are opening for K-12 student from Monday, but school for special students, special needs student, and essential care workers, their children are already going to school. Have you seen any drop in attendance in this week?
So what I'm understanding, just from the anecdotal information that we have from this week, is that attendance has been fairly low. And so different districts handled the essential service workers sort of categories somewhat differently. In some districts, it was quite broad. In other districts, it was quite narrow. And again, districts did that analysis in terms of how many essential service workers, children that they actually have in their districts. But from what I understand, the attendance was quite low. We saw that in the March of 20 or spring of 2020 as well, that even when schools were open for essential service workers, children, and for disabled children and children's disabilities, a lot of families tended not to send their children, though, of course, they are welcome to, and they are welcomed in schools, because we know how important it is for schools to support our healthcare workers and other essential workers as well. But it tends to be when schools aren't open broadly that there are, a reduction in the number of students that attend, even though they're able to.
Do you think that the school will be adopting the hybrid learning program anytime soon because of the teacher staff shortage and the spread of Omicron variant? What is your opinion?
Well, we really hope that doesn't happen. We want to keep schools open. And again, hybrid learning did not work very well, because in order for hybrid learning to actually work, additional staffing needs to be hired. Teachers can't do a full-time job inside classrooms and online as well. And so that didn't work when it was in place before without that additional staffing. So we want to see schools open and safe, and that's why we think our measures that we're advocating for need to be put in place.